everyone, I think, between this and the other two things that we're working on.
So is there anything jumping out at anybody that anybody has any major concerns about then? Anything that jumped off the policy or any of the materials you were given? And you thought, wait a minute, that doesn't seem right. Okie dokie. We'll leave it at that. If anything during the course of this comes up that you do have questions, please feel free and I will answer the best I can. Sorry,
Awesome.
Pauline.
Thanks, Melissa. I did just hit record on this. We're going to use it for anybody that's missing this session and or if people want to review it, this one or the other team's one, because there's two different case studies. So Oates is going tomorrow and they're going to have a different case study. So if you want to see it from a different perspective or a different case study, you can watch theirs and vice versa, they can watch yours. So I'm going to share screen and I'm going to jump to documenting within Meditech. Okay, so I'm just going to go right along with the tip sheet as I'm doing this. So the tip sheet was mailed out with the package. Hopefully it's pretty straightforward just to follow along the tip sheet, but I'm going to show you some of the pieces that were built into the tool that are going to alert you or flag you to certain things. Has anybody gone in, like just wave your hand at the camera, I can see most of you. Has anybody gone in and tried looking at the tool online? I see a couple of head nods, a couple of head shakes. Okay, so mixed response here. All right. Okay, so in your search documents, I'm going to search for Columbia. You can favorite either and both actually. So I'm going to review the lifetime first, and then we'll take a peek at the screener. So I'm just going to favorite both while I'm here and go in and check out the lifetime. Move that around. Okay, so the first thing you're going to notice is you're going to notice a massive protocol. So this was definitely in the resources that were given to you, but basically it tells you what the question is asking and then some descriptors. So a way you can ask the question and then sort of what the question is looking to answer, okay? So that is the very first thing you're going to see. So we are in the suicidal ideation section at the top, very first section of the scale. And each of the 5 questions has the question header, an example question that you can ask, and then sort of what it's trying to get at. There is a text box here to add content. I'm not certain what this is here for. Please ignore this box, okay? And just go right to question number 1. So the asterisk beside indicates that it is a mandatory question. So the wish to be dead. Now, when you're asking a patient, client, wish to be dead, have you wished you were dead or wished you could go to sleep without waking up? That's what you're asking. Patient is saying, yep. So was it in their lifetime? You're going to click here. Was it in the past month? You're going to click here. And if it was no, you're going to click here. Now, the system has a built-in failsafe that you cannot select no and lifetime. It's going to prompt you to not do that, okay? So I'm going to remove those, no. And now the answer is just no. But let's say for the example here that the patient has said it, yes, they said it 10 years ago, and then they all said it within the past month, okay? Non-specific active suicidal thoughts. So what does that question mean? Again, back to my protocol, here's what it means. So yes, let's say that they have had some non-specific thoughts within their lifetime for sure, and then within the past month. Once both of those have been selected, now you see there's asterisks beside 3, 4, and 5. So now that makes these 3 questions now mandatory as well, okay? So again, we're gonna read the question. For the first few times you do it, you're gonna go back to the protocol, but then you're gonna just remember, hopefully, what each of these questions mean. So has there been active suicidal ideation with any methods, but not having a plan? Without the intent to ask. So let's say yes, lifetime, active suicidal ideation with some intent to act without a specific plan. So let's say yes, lifetime and past month for this one. And then active suicidal ideation with specific plan and intent. So let's say yes, lifetime, but not the past month. So now each of those questions has been answered. You can, as with any report available in WebAM, you can click on the comment box to add context to any of these responses that you want to. And then there's a prompter question here. The next question is only required because of the way that Meditech has to be built. You can't build so many parameters in certain things. So read the instructions when they're available to you. The next question is only required if any of the previous questions were answered as a lifetime. So we scroll back up. A couple of them were answered as lifetime. So then we are responsible to, it's been flagged here. So now we have to respond to this question. So please describe the suicide ideation details. Okay, so let's say you filled that in. Oh, they've put another comment box in there. Please ignore this comment box as well. I accidentally clicked on it, and that's the only reason I knew it was comment box, but put your content underneath the question, the query, okay? So then we continue on with our sections, and it's going to be, the response pattern is going to be very similar throughout the rest of the scale. So intensity and of ideations and score. The next 5 questions are only apply if question 1 above or 2 above were answered as the past 1 month. So back up here, past 1 month, both selected for both of these 2. I'm just going to test something and see what happens. Let's remove those. These are not mandatory now, okay? So I'm going to go back up and mark them again as past 1 month. Now they should have become, yeah, now they've become mandatory, okay? So frequency. What is the frequency of the ideation? So how many times have you had those thoughts? Sorry, protocol here. You'll see the description just in test right now to the question that was just asked. So a protocol is going to tell you the exact questions. This is also available in your documents that you were sent out. So again, have it printed if you want for the first few times you're going through. So let's say that it was less than once a week in the past month, less than an hour, but some of the time, and we can, you know, say less than an hour during hours before bed, if you want to quantify that. So okay, if I could spell, that would be helpful. Controllability. So what is that asking? Can you stop thinking about killing yourself or wanting to die? Unable to control those thoughts, right? Deterrence. What does that mean? Are there things, anyone or anything that could have stopped you from wanting to die? Yeah, some deterrence probably is what stopped me. This is a single select, as all of these questions should be. So if you try to select another one, it's going to remove your previous response, okay? Questions are still mandatory. It won't let you sign off without completing them. So reason, mostly to get attention. And you can quantify that. So you can say, okay, if that's content that you think is relevant. It's going to give you a score of the intensity section, and then you're going to go into the actual attempts or suicidal behavior. Again, protocol is here. So what have you done anything dangerous where you could have died? Here's some questions you can ask to elaborate. Okay, your protocol is listed here. Have you made suicide attempt? And this is what asking you to respond for the lifetime or the past 3 months, okay? So suicide attempt in lifetime, yes. Past 3 months, no. So we'll leave that off. Have you done anything to harm yourself in the lifetime? Yes. Past 3 months, we'll leave that off. Anything dangerous where you could have died? Let's say past 3 months. Yep. And then if yes to anything, describe here. Okay. So you can also put a brief descriptor here, but this is limited characters. This should have 200 characters. So you should be able to put a bigger description in here, and it is a mandatory question. Okay. This is then asking for the actual number of attempts. The tool is looking at, so I think on the paper tool, it has 2 columns and you would go across and score those. This is how it's built into Meditech. So actual number of attempts, you're going to put it in. In lifetime, actual number of attempts in the past 3 months, we said there were none. So we're going to put a 0 in there. Okay. Has the subject engaged in non-suicidal self-injurious behavior? We'll say yes, lifetime, and not in the past 3 months. Okay. But I'm going to leave this one blank. Just you guys have all seen it where a mandatory question is not answered. I'm going to leave that one blank. Interrupted attempts, it's the exact same format as the previous section, looking at lifetime in 3 months. Okay. So I've said yes, lifetime. It's now asking me to describe. Okay. And then enter the number of times this has occurred. Okay. And then this section is going to be the same thing. So it's a repeating pattern. So once you have the content down from the self-study, the tool in these sections is just repeating response. Sorry, I see there's 2 questions. Let me just, give me a second. Yes, everything is going live on the 25th. Okay, suicidal behavior, aborted or self-interrupted. Brief protocol there. Has there been a time when you started to do something to end your life but stopped before you actually did? So let's say yes, lifetime, not in the past few months. Describe. We're going to enter the number of times. And a lot of clients, patients won't remember the exact number of times, but just it's important to get something in there that's a close estimate. This section is the exact same format. So has it happened in a lifetime? Has it happened in the past 3 months? So yes, describe. Yep. Now I'm just going to remove that. It's looking at the description of the lifetime events, okay? One. And then the lethality, if there was any medical damage happened there. And so a bigger protocol here showing you what each of the scale scores mean, which again is from your self-studies. But fully describing what each score represents in terms of how much damage was inflicted. Okay. Most recent attempt date. Now this is a free text rather than a calendar. So let's go with January 25. And then comparing back above. So the most recent attempt, let's say there was moderate damage, but it had potential. The most lethal attempt date, let's say, was sometime in their teens. Okay. And then again, rating the damage that occurred there. So severe. Okay. I have to put things in here, but it's all, you can see the same reporting pattern all the way through. The questions are flagged, they're mandatory. And then, so mandatory to put the dates in. And these dates make no sense because I'm just putting them in as I go. I know that the first attempt would have been before the one before that, but I'm not going to math right now. Okay. And then your workload time, which we've talked about having to add your content for this. So if the client doesn't know, Jessica, thanks for the question. If the client doesn't know the attempt dates, put the closest that you can think of. So if they can say, oh, it was when I was 16 or it was when I was a teenager, just put something like a year in there because it's a free text and not a required actual date. So I'll go back up to that. To qualify for, in order for the mandatory piece to be, like for the system to say, yep, that was answered, we can just put in a date. So, and that will take it off, okay? So the closest that they have to the date to put in. If they knew it was this summer, you can put that into, okay? Did that answer your question? It's going to be mandatory, so you're not going to be able to sign off until that's done. So then I'm going to sign, and I forgot to answer one. So if I can remember what question it was, I can describe, or I can click cancel out and then go back and see which one that I didn't describe in. But I am not going to search for it right now. I'm just going to type something in. Okay. Sign it. And here is how it will view. So each of the subsections laid out, and then the actual scores, actual responses here. Okay. And then in the chart, give it a Meditech minute to catch up. It'll be there. It just takes a moment. It will be there. It just takes a minute. Okay, let me just double check the tip sheet because I think we got everything that was on the tip sheet. Oh, that's a good point. Okay, so within the document, there is one section where you will get a pop-up. So in the very first section, if question 1 and question 2 are both no, you'll get a pop-up indicating, please, you don't need to answer the rest of these questions, proceed to the suicidal behavior section, okay? But then you know that nothing else is mandatory, so you don't have to answer those, okay? So you don't have to answer this section either. None of those are then mandatory. I think it's flagged, but we're now in the suicidal behavior section. We need to start answering here again, okay? Just referencing my tip sheet again.
I just wanted to add that in your materials that went out, one of the documents that you got was the pediatric version of this tool. The intent behind that was sometimes, and I think as we've been kind of working through this, the questions already come up, might be more relevant with a dual diagnosis crew, but from time to time we do get people at OATS and MTST that may be dual diagnosis. Some of the language might not be working. So the pediatric one was included to give you some alternative ways to ask the question that you might be able to get a more effective answer from. So it's just there as an option. If you ever think that the questions aren't landing properly, you might want to take a look at that one and see if that helps. Also included in your material, there was a safety protocol. It had a printable version of this along with that triage chart. The method behind the madness there in including that was thinking more about you guys at MTST, that it's something that you can print. You might not have a laptop in front of you. You might not be able to do this stuff by memory. So it's something that you could possibly keep in your car, keep with you as a reference to guide you through the questions. And then the protocol is also embedded in that as well. So the kind of decision making is there as like a cheat sheet. So that was the idea behind that. So appreciating that you don't always have access to Meditech, you won't always have access to this. If in the moment you want to ask these questions, you could have them handy that way.
Thanks, Melissa. So that was the lifetime, which will be included with the documentation standards for your initial visit. And then we have the screener that you can use on visits as needed. Okay, much shorter. And then if anything in here prompts you to say, like, I think we need to dig a little deeper, then you can go back in and do the full scale again. Okay. So the only thing that the system is doing a little bit auto in this one is that on question 2, so question 1, have you ever wished you were dead or wished you could go to sleep without waking up? Yep. Have you actually had any thoughts of killing yourself? So on question 2, if you answer yes to it, you'll see question 3 and question 4 and 5 then become mandatory. If you say no here, then you are basically can jump down to here. Have you done anything, started to do anything, or prepared to do anything to end your life? So yes, within the last 3 months, and it's giving you a high risk. If you are saying yes, within my lifetime, moderate risk, or no, you have no risk, and there you can sign off and you're done. Okay, let's go back to the top and let's just say person has actually had thoughts of killing themselves since the last visit. Okay. Have you been thinking about how you might do it? Yep. Have you had these thoughts and some intention of acting on them? Yep. Have you started to work out the details of how you're going to carry out the plan? Let's say no to that one. Have you done anything or started to? So they haven't actually started to, but they've done all these other thinking pieces and planning pieces. It's still going to be rated as high. Okay. So the scale is just really quick, 6 questions to give you your level rating. And I thought there was a protocol attached. The protocol must be attached to the full one. Okay, I have to add my workload, otherwise I can't sign off. Have we officially shown this workload piece at Huddle yet? I can't remember. I've shown it so many times. Anybody?
Not that I remember.
Okay. Well, if I have extra time at the end of this, maybe I'll show you this one as well.
Yeah, I don't think it was shown at Oats either in Huddle. We made reference to it, but
Okay. This document is obviously much shorter. And then please, Meditech, do what you're supposed to. Okay, so there's the first one. This was the full lifetime is now in here. And there it is in report format. The other one should be here momentarily. Okay, I hope you get the point with that though. This is what it's filing under, mental health suicide risk assessment. Okay. And that is the tool, and that is the tip sheet overview. Any questions about the tool? Anything you want to see again? This is sort of the first time that any of the CI builders have used these, what they're calling jump rules. And so if something is mandatory, they're making you jump to a different section. And I think it's working quite nicely in this tool. So if you have a different opinion, please let me know. Any questions? Okay, we're going to get into the case study then. I'm going to take a quick drink and then let's do this case study as a initial, okay? So give me 1 second. So we have John, 53 years old, separated, was diagnosed with schizophrenia and polysubstance use. Has everybody had a chance to read it? So I'll just go over the pieces that sort of pertain to this. I'm getting no movement. Okay. Separated for 20 years, was originally charged with uttering threats, been on probation, has been with your team for 5 years now and has some anxieties, worries about having to go to the ACT team because he likes the team he's with. Nice touch to put that in there, Trudy. You guys have been treating him well. He engages in the cooking group. When he was in his mid-teens, he had some cutting behaviors when things got more chaotic at home as a result of some abuse from his stepfather. He was taken to hospital where he actually had some relief from the behavior from his stepfather. At 17 years old, he cut himself more deeply, but he states this was by mistake and he bled a lot and it scared him to never cut again. His first admission to Waypoint was at 18 when his parents found him with a gun and stated he was going to shoot himself. Again, diagnosed with schizophrenia during that admission, started smoking in grade 7 and by grade 9 was then smoking marijuana. He's used drugs and alcohol throughout his life, and now he mostly uses marijuana and alcohol over the weekends. Supported employment activities in place with the town for a little while, type 2 diabetes, taking some meds to manage that. His parents separated when he was quite young, and he lived with his mom and stepfather, who was physically abusive, often missed school, had some learning, told he had a learning problem, but wasn't certain what that meant specifically. Stepfather deceased, mom deceased, doesn't see the rest of his family at all frequently. His mom has history of depression, biological father, bipolar. He has a cat who's very, very important to him, but his cat is not allowed to be living where he is. So he's also worried about that being found out. Doesn't have any close friends, tries to avoid people, and he sees an MTSD clinician every 2 weeks for a visit and receives injection every 4 weeks. Doesn't like his meds, but knows he needs them. Okay, so case study. Let's go into just want to see if the other one showed up yet. There it is. Okay, I'm going to show you real quick the other one while I'm in here. The other report looks like that. It's filed under the same title. So we are going to document on a lifetime. Audience participation. So, does John wish to be dead?
No.
No. Lifetime?
Yes.
Okay.
Oh, not currently.
Non-specific active suicidal thoughts. Lifetime?
Yes.
Yep. Past month?
No.
Okay. Active suicidal ideation with any methods, no plan? Lifetime?
Yes.
Thank you. I appreciate Laura, because I don't have to look back every time to see if people are nodding. Past 1 month?
Not that I remember.
Okay. Active suicidal ideation with some intent to act without a specific plan. Lifetime?
Yes.
Past 1 month. I think pattern here is no for this guy. Specific plan or intent in lifetime.
Yes.
So we need to describe those details from his lifetime. Anybody want to take a go at that? I can choose somebody, and I tend to choose people who don't have their cameras on. So
He
anybody?
had a gun.
Oh, I can't hear you.
He had a gun.
He had a gun. Okay. I can't see my case study right now, so if anybody wants to fill in additional details that you would normally document in this.
He had a gun and he said he was going to shoot himself.
Awesome. Thank you, Marianne. Okay, so only mandatory if question above 1 or 2 were past 1 month. They were not. They should not be mandatory. Sweet, we're going to skip right past that section. Okay. Suicidal behavior, actual attempt. Okay. Have you made a suicide attempt? Lifetime? Yep. Past 3 months? No. Oh, I'm seeing it's like bobbleheads now. Yes and okay. Have you done anything to harm yourself? Lifetime?
Yeah.
Yep.
Yes.
Past 3 months? Thank you. Have you done anything dangerous where you could have died? Lifetime? Past 3
Yeah.
months? Dawn, was that a I don't know? Is that a maybe? Do you want to describe? What was the past 3 months that you no? Straight up no? Okay. So if yes, describe. Probably the same description that we already put in above, right?
But didn't he cut himself? He didn't mean to do it that bad, but he did do it.
I think it was 16. Yeah, we can add that here. Yeah.
I'm reading that. Yeah, I think it was 17. By mistake. Bled a lot.
He was 18 when he had the gun, by the way.
18 for his first admission. 17 for his first cut. Get your facts right, Mary Angie. Okay.
Stop fighting, kids.
We're not even in the same office. Jeez.
Okay. Actual number of anything else anybody would add in this section? No? Okay. Actual number of attempts in lifetime. I don't know that it's specified, but we can, based on the information we have, we can assume.
Just the one, right?
1.
Two, probably.
Do you want to count the cutting as an attempt? Yep. Okay.
I think they described that in the videos, yeah.
Okay. Number of attempts in the past 3 months, not mandatory, so I'm going to leave it blank. Has subject engaged in non-suicidal, self-injurious behavior? The cutting, yep. Okay. Interrupted attempts. Has there been a time when you started to do something to end your life, but someone stopped you before you actually did anything? So would John have this in lifetime? Yep. Past 3 months? No. Okay. Describe, so same as above. I wouldn't normally put that, but I just want to save some time. Okay, actual number of attempts in lifetime. We agreed 1. Oh no, we agreed 2, sorry. Although, okay, let's question this one. He said that the cutting was a mistake. He didn't want to kill himself on the cutting. So what would you score this one as?
In the training, it said if it was accidental and it wasn't an
Yeah.
actual attempt, that it didn't count as an attempt, right?
And
Yeah.
the patient is stating that it was accidental and didn't attempt.
Yeah, I think the way the training
Correct.
presents it is if it was like Laura said that if it was cutting that went wrong, that the actual intent there wasn't to end their life, it was an accident, and that's what's being reported. So based on that, I wouldn't count that.
Aborted or self-interrupted. Did John start to do something to try to end his life, but stopped before actually did anything? Lifetime? Yep. Past 3 months, no. If yes, describe.
But he didn't actually stop himself. Family did.
Good point. Okay, what do you, I'm just going with the flow here. So what would you put, Cindy?
Attempt made, but stop. I think I'd still put stop by family, but he didn't actually. So that question kind of leaves you, because really, if you're answering it, no, he didn't have an attempt that he tried to stop.
Yep. Might be an opportunity to ask further questions of the patient to describe a little bit further what, whether they had an intent on that one or not, whether if the family hadn't stopped them, you know, would they have gone through with something? Okay. One there. Was John prepared? Has John taken steps towards making a suicide attempt or preparing to kill himself, such as collecting pills, getting a gun, giving away his valuables, or writing a suicide note in the lifetime? Yep. Past 3 months? No. Anybody want to describe, would the description here be any different from above? Oh, spell check, thank you. Number of attempts in lifetime? Thank you, Tracy. Not mandatory, we're gonna leave that one out. Okay, and then looking at the damage that occurred. Most recent attempt date. If we don't have the actual date, can someone just make something up based on roughly how old John is and when he stated it, the age it was?
Just like a estimate, like 27 years ago,
Yeah, so what is he? I can't remember. He's 58, so
50 something, and he was like
35
late
years
teens.
ago.
There you go.
35 minus this would be 1989-ish.
He's 50.
Sorry, I missed that if someone said something.
Yeah, he's 53.
Okay. Sometime in the late 80s. Okay, so what was the damage? Oh, I should have asked above. Would anybody put on any of these additional qualifying statements on any of these pieces?
I don't know. Do you want us to?
I mean, would you, if you're meeting with a client? I think that the comment section here to describe is pretty self-explanatory, but if you were meeting with a client, would there be, if you're meeting with John, would there be content pieces that from his history that you would note? It's available. It's an option if you would like to. It's there.
Well, if parents stopped him and he says he really wasn't going to do it, he was just frustrated, you might want to put that down.
This is a good place to put direct quotes as well, if you're able to capture that kind of stuff. Direct quotes don't really leave it up to interpretation, right? Like you're using their actual words.
Okay. So for the most recent attempt that was 35 years ago, what was the result? What was the damage result to him? Using the scale above here. So no physical damage or very minor. If we're considering that the cutting incident was a mistake and we're not counting that as an attempt, everyone agree that 0, there was no actual damage on that one? Yeah. Potential for damage on that one?
2.
2, thank you. The most lethal attempt date. would be the same, right? Anybody have a different opinion on that? The most lethal and most recent was the same event?
Said he went to the hospital for that one. Would that be
Admitted at 18.
would that be considered zero still?
On this one, he was hospitalized with the gun incident.
Oh no, sorry, I'm looking at the cut incident. Sorry, I was talking about the cut incident.
Okay, so if we assume that the cut incident, like he's telling us that it was an accident, but if we're assuming that it was an attempt, we can put that in as the most lethal attempt, and that was what the year
Yeah.
before that.
Yes, he was 17.
This in the train.
Okay, so what was the damage then from the cutting?
He just said it bled badly. Bled a lot.
Okay.
And I don't know, whatever.
We go with number 2, moderate, medical attention needed, bleeding.
Yeah, I don't know if it was a major vessel, but
So a minor
maybe,
damage,
I guess. I don't know. Yeah.
mild bleeding, sprain, somewhere between 1 and 2. Anybody feel strongly about either one?
Again, that's just the information that we have. That's something you'd probably want to ask more questions about.
Um, okay, what was the potential of that one?
I don't know, maybe moderately, I guess. I don't know.
First attempt date. That would be the cutting incident, or was there, I can't remember from the case study. I'm sorry, was it reported before that?
I think that was the first one, I guess, which would be 1988, I guess,
Oh, yep.
or whatever. Yeah, the year before the gun.
Okay. So if it's the same incident that we're referring to, we're going to just copy the same information. And we should have filled out all the required sections. We'll add our workload time and then sign off. Does anybody have anything that they would change based on our case study? I mean, we have pieces of snippets of information. We would be having a conversation with the client or patient, and if we had questions in certain areas that we weren't clear on, we could ask further details. And this was a pretty straightforward case. Like, he had a couple of incidents. There may be patients who have multiple incidents that you're going to have multiple dates to refer to. So
I don't know that I would have put the cutting as a suicide attempt, because it said he did it so that he could get away from his father, their stepfather, because they would then hospitalize him and he got away from the situation. So to me, that's him. He found a way to get sent out of the house to deal with.
So you would believe him when he said he did it. He didn't mean to inflict that much damage. It was just a way to get arrested.
Well, especially when he cut himself deeper and he never cut himself again after that.
Yep. I mean, that would probably be a case of like asking further prompting questions on that one. And if you knew the patient, or if you had reports from previous visits on that patient, to dig a little deeper into that one. But yeah, I would agree with you, Cindy, that you could view it that way for sure.
How often am I
It would
doing
matter
these
on the
things?
percent as well, right? Like, let's say we asked him and he said 98% was just superficial cutting. But if 2% said he wanted to die, like, even though it was minuscule, it would be considered an attempt, I believe, from the training.
Yep.
Is that correct? Yeah.
There was some intent there, mostly didn't want to, but there was some intent there. I'd probably tend to err on the side of caution on that one.
Yep. Same. Marianne, your question about how frequently are we doing these report, so the same that you would have done the NGASR. So the lifetime is going to occur on the initial with the initial visit. And then any of these screeners can happen whenever you feel it's necessary for one to happen. So if you've noticed a change in mental status in a patient and you feel like one is warranted, do this. And then if you're feeling like this one's not enough, go back and do the lifetime again with them. It's up to you as a clinician to use your judgment on that. Okay.
So the training said we had to do it every time we saw them. We're not actually following that.
So
I think that's the
Michelle-
C. I think that was for the CVAT, Cindy, because
I believe that was for the CVAT. Let me just check with the new documentation standards. Give me 1 second.
Yeah, it's the same as you would do it now. You're going to do it on your initial assessment, and then anytime that you think that there's something going on, you want to check it out, you want to document something, we've always been able to open them up and do a screening whenever we think that's necessary. So that's changing. The standard workflow is not every time you see them.
And the documentation standards say first visit required and then as needed.
So
So
that's why I was asking that, because what our documentation standard said and what the video said was two separate things.
Oh.
So
Yeah, I do think I recall the video saying that, but no, that's not what we're doing. We're doing on the initial, and then anytime you think that you might need to, just the same as we do now.
Good question, Cindy, though. The video was not produced by us. They were resources that we gathered to send out. Okay, I'm going to show you real quick how to do the workload. I'm not trying to overload your brains right now, but the explanation behind the workload piece is that in Meditech web system, there's web ambulatory, which you guys are documenting, and web acute, which providers, doctors are documenting in. Reports are shared between those two systems. What happened was providers, doctors are not required to capture their workload time with patients. And so several of these shared reports were built that did not have workload attached to them. This is one of them. So the Columbia is going to be available for providers to document on if they so choose. Anywhere that clinicians need to capture their workload time, we had to add this in a way that didn't make it mandatory for providers. So under workload time, there is a descriptor that says workload is not mandatory for providers. Therefore, doctors, ignore from here on out. It'll still let you sign off at this point without completing it. As clinicians, we want to capture your workload time for statistics. This is how we get money, is the amount of time we spend with patients doing patient-facing things. And I know you guys are tracking that as one of your QI things as well. So for clinicians, workload is mandatory. Please document workload time. You're going to go to this add content button. Okay. If you type in WP, there's one labeled waypoint outpatient workload.